Hi, my name is Don. I'm a first-year general surgery resident, and I wanted to share with you the experience of my first week as a doctor. Ever since I graduated from medical school in May 2018, I've been looking forward, although a little bit intimidated, to starting residency. And I must say, it does live up to the hype. The learning curve is definitely steep. I would say that clinical experience and medical knowledge is not the biggest issue at this time, but it's more about learning about the workflow and the logistics of how to do things, especially since I moved to a new city and I'm working in a hospital that I've never worked at previously. I probably look lost 90% of the time, but I'm okay with that. I'm still learning my way around the hospital, knowing how to use the multiple computer softwares, and knowing who to call, when and how, and even simple things just like washrooms, call rooms, and cafeteria. It's just an extra layer that contributes to me being overwhelmed. I'm sure things would be just a little bit smoother had I done residency in the same school and hospitals where I worked as a medical student. One thing I noticed already about being a resident versus being a medical student on a surgery rotation is that although I don't know much more than I did last year in fourth year when I was doing surgery electives, I'm definitely less stressed about evaluations and seeking letters of reference from staff surgeons for my surgery application. As a student, especially on rotations at schools I was interested in applying, I was always trying to seek maximum face time with staff surgeons in the clinic or in the operating room. And some days definitely felt low yield when I was just stuck on the ward with a junior resident and not meeting anyone important or on the committee of surgery, for example. As a resident, I can really focus on helping out my team more because I can actually sign orders. I'm a bit more in the loop with what things are going on the ward, and I can really just focus on being a doctor. As a student, I found that a lot of patients actually respect you just like they would other doctors, and that's never been an issue. As a resident though, I found that there's already this slight difference in the way you're treated by other hospital staff, such as fellow residents from other services, staff physicians, and nurses. It might also be just psychological that I feel more useful, I feel more aware of things, and I don't feel as potentially bothering as I did as a medical student. I definitely felt this more strongly in the operating room, which I had the chance to go to this week despite being a junior. It finally felt like I was a surgery trainee and not just a surgery enthusiast or even a student that was on a mandatory surgery rotation. I'm not sure what kind of videos I'm going to make in the future, but I do know that I want to document the process of going through residency and learning all these things and hopefully demystifying what surgery residency is all about. I'll see you guys in the next one. Bye!